Hi, my name is Katie Cernkovich, and I will be discussing yellow fever. I'm first going to start off with some history. So, 3000 BC was when yellow fever is believed to have evolved in Africa. In the 1600s, yellow fever was imported into the Western Hemisphere on slave ships from West Africa. In the 1700s is when yellow fever spread to Europe, and the first epidemic was described in 1730 in Cadiz, Spain. Until the mid 1800s, scientists believed that yellow fever was spread by direct contact with infected individuals or contaminated objects. But in 1848 and then in 1881, American physician Josiah Clark Knotts and Cuban physician Carlos Finlay first suggested that the vector might be a mosquito. In 1900, the Reed Yellow Fever Commission proved that yellow fever is transmitted to humans by Aedes aegypti, which is a mosquito. In 1932, yellow fever vaccines were developed, the 17D vaccine and the French neurotropic vaccine. After these vaccines were released, then vaccination campaigns began, the 17D vaccine being used in South America and the French neurotropic vaccine being used in French-controlled parts of Africa. In 1982, because of the high rates of post-vaccinal encephalitis, the French neurotropic vaccine was abandoned and the 17 vaccine became standard for yellow fever immunization. In the 2000s, yellow fever vaccine was incorporated into the routine childhood vaccinations of several South American and African countries. The structure of the yellow fever virus is that of a positive single-stranded enveloped RNA virus. The yellow fever virus is found in arthropods, primarily ticks and mosquitoes. As for the phylogeny of yellow fever, there's no order assigned, but the family is Flaviviridae, and the genus is Flavivirus, which contains viruses like the dengue fever and the Zika virus. The species is just the yellow fever virus. Yellow fever is primarily transmitted to people through the bite of infected Aedes or Haemomogus species mosquitoes, depending on the continent. The mosquitoes acquire the virus by feeding on infected human or non-human primates and then can transmit the virus to other primates. There are three cycles: the sylvatic, urban, and intermediate cycle. The sylvatic cycle occurs in a jungle, and it's between non-human primates, that is monkeys, and mosquitoes, and it can be transferred to humans when they visit or work in the jungle through the mosquito biting them. They will then transfer it to an urban setting, starting the urban cycle between humans and urban mosquitoes, primarily the Aedes aegypti, where it'll go human to mosquito to human to mosquito until the cycle continues. There is also the intermediate cycle, which is essentially the same as the sylvatic cycle, except it occurs in the savanna instead of a jungle. This is an image of what I just described to you. As you can see, it's primate to mosquito to primate, on and on and on. These are the areas of risk. So as you can see, South America, you have Brazil, Colombia, Bolivia, all of these countries that are where the vaccine is recommended because there's a higher chance due to the climate of the mosquito infecting you. In Africa, it's basically just Central Africa where the vaccine is recommended, but there are other places along the eastern side too. These symptoms occur after 3 to 6 days, and the majority of persons infected with yellow fever have no illness or only mild illness. The initial symptoms are kind of similar to flu symptoms. There's fevers, chills, severe headache, back pain, general body aches, nausea, vomiting, and fatigue. Most improve after the initial presentation of symptoms, but about 15% of cases after a brief remission of hours to a day, it's a very short term, they develop a more severe form of the disease. And the severe symptoms include high fever, jaundice, bleeding, shock, and failure of organs, which can lead to death if not treated. There's no specific treatment for yellow fever. It's purely symptomatic, so they deal with all the symptoms mainly with rest, fluids, and the use of painkillers, pain relievers, and medication. Someone with yellow fever should avoid aspirin or other nonsteroidal anti-inflammatory drugs because they may increase the risk of bleeding, and you're already at risk when you have yellow fever or a severe form of yellow fever. Among those who develop the severe form of yellow fever, 20 to 50% die, which I'm going to make an educated guess is probably because they don't seek hospital care or they have no way to. Those who recover from yellow fever generally have lasting immunity against subsequent infection from this virus. So to prevent yellow fever, we have the 17D vaccine, which is now commonly called the YF-Vax, or yellow fever vaccine. It is a live virus vaccine. It's been used for decades, and a single dose provides lifelong protection for most people. It's recommended for people aged 9 months or older who are traveling to or living in areas at risk for yellow fever virus transmission, that is Africa and South America, but as we looked at the cycles, it can travel to urban settings. There are some people have had reactions to the yellow fever vaccine, mild being headaches, muscle aches, low-grade fevers, really not too bad. And then some people have severe reactions, like life-threatening allergic reactions, disease affecting the nervous system, and disease affecting certain internal organs. It's not recommended for those with allergies to vaccine components. So if you're allergic to eggs, because they use eggs to grow the virus to create the vaccine, you shouldn't get this vaccine. It's also not recommended for those under 6 months of age or those with immunodeficiencies due to age or other health issues. Over the last 30 years, there's been a major increase of yellow fever infections, probably due to factors such as low vaccination coverage, urbanization, migration of the human population, and reinfestation of the Aedes aegypti. So if you're going to travel to Africa or South America, definitely check CDC or what's the different countries for what they require when it comes to vaccines, especially because you wouldn't want to bring it back to an urban setting. Okay, that's yellow fever. Thank you.